So when it comes to working with human, these are the main aspects which we have to consider. There are two types of clinical trials. Here you can see that. One is a clinical trial, other is an observational studies. In the case of normally a clinical medical trial, it is normally led by a principal investigator who will be the leader of that project, or who is the main person who is managing the all aspects of that project, and he will be calling as the principal or the main investigator. And most of the time he or she will be a medical doctor also. And clinical studies also have a researcher team that include doctors, nurses, social worker, and healthcare professional. That is, when we are studying the effect of a particular newly discovered drug, should be there will be a team of investigators, your team of experts who will be coming from various fields. Doctors will be there, nurses will be there, social workers will be there, and other people who are involved in health care will be also involved in that study. So in a clinical trial, the participant receives specific intervention according to the research plan or protocol created by the investigator. That is, intervention means actually introduction or injection of a drug is an intervention, or introducing some object into your body. That is an intervention. Or carrying out a special kind of surgery. That is, so any special technique that we are doing on a particular person is known as an intervention. And sometimes a change in diet, that is also an intervention. So most of the time we have to take a consent from that, and about the consent we will come to that. So clinical trial may compare new medical approach to the standard one, that is already some kind of treatment method may be, for example, in case of corona or in case of heart attack. Already we have a standard practice of treating the patient in a particular way. But when a new method is suggested, we have to make a comparison with the present method and the new method. And what are the benefits of the new method compared with the existing method. That is that. So clinical trial may compare new medical approach to a standard one that is already available. So that is the main aspect which are coming under the clinical trial. Now a slightly different way is the observational study. The investigator assesses the health outcomes in a group of participants according to the research plan or a protocol. Protocol simply means a plan. Participants may receive intervention or procedure. Intervention means already any kind of new supplying them with a new drug, or introducing a new device, or introducing a new diet, or asking them to behave in a particular way. All these are intervention. But participants are not assigned to specific intervention by the investigator. Here you can see that the participants may receive intervention as a part of the routine medical care, but the participants are not assigned to specific intervention by the there is a slight difference between the clinical trial as well as an observational trial. Clinical trial is a more active form of testing the drug or testing the new method on the patient, where this is not there, it cannot be considered a more active way of. That is the main difference between the clinical trial and observational study. In developing and testing new drugs with a therapeutic potential, therapeutic means medical potential, it is usually necessary to conduct studies on human volunteers. Now, in order to serve the goal of minimizing the potential risk to human subject, special care has to be given. So that is also another aspect. So when we are working with a human volunteer, we have to take care that he is not going to die. Because of our new method, because of introducing a drug, he will be remaining healthy after some time, after period of trial. He is not dying out of the treatment or method. So that is the main aspect, that we have to reduce the potential risk. Human volunteer subject must be informed that drug that they are receiving are known to have significant potential for addiction. For example, when you are taking some marijuana or opium or such types of drugs, they have a tendency to make you addict. We have to take the drug again and again. That is known as addiction. So in the use of some new drugs also, sometimes when we are introducing them, maybe the trial may be for only for 6 months. So if they are having that drug for medicine for 6 months, after the 6 months again, they need to take that drug for a period of for 1 year or 2 years. And that is known as a dependency or addiction. That he or she must be clearly informed about the potential for addiction. With some exemption, potential volunteers subjects who have a non-history of addiction should be excluded. So a lot of things have to be known. So when we are selecting a volunteer, we cannot take every person. We have to make sure that the person that you are selecting have no previous history of addiction with any particular drug. That is one. Otherwise, he or she also have the same problem again. In addition to informed consent, I think I have explained in the previous class. It is a kind of consent given by the human volunteer after knowing the positive side of the treatment as well as the negative or harmful effects of the treatment. Then after making a detailed analysis of the existing knowledge regarding that, he gives a voluntary consent. That is known as the informed consent. That is, he or she will be informed about all the possible harmful effects of the drug. Only after that he or she has to give the consent, and they also have a right to withdraw that consent at any time during the, for example, it is a 1-year study. After 3 months of the study, the person feels that I cannot undertake the study, he can withdraw. So that is the type of consent known as the informed consent. In general, clinical studies are designed to add medical, because without any kind of clinical study, it is impossible to produce new drug. Now, what happens mostly in India is the Indian researchers usually discover a lot of new medicines. But in India, the medical trial on human volunteers is very difficult. So most of the time, what is happening is that when an Indian scientist is discovering a new drug, most of the time he may not be able to undertake the clinical trial. Clinical trial in India is very difficult and very complicated also. And sometimes a person in a Western country or in America may be knowing about the new discovery. They are conducting this human trial is more easy. So they will conduct human trial there and they will market the drug, and what we do, we will be purchasing that drug from America. So then that will be increasing the cost of the drug. So this is usually what is happening in the case of medical research in India. That is why many of the techniques that many of the drugs we have to import from America or Europe, and when they are imported from America or in Europe, the cost of the medicine will be very high. Some common reasons for conducting clinical trial: evaluating one or more intervention, for example, drug or medical, you have to understand how effective the particular drug, or how effective the new medicine, and or how effective this new device. All this has to be evaluated. Then finding ways to prevent initial development or recurrence of a disease. That is another aspect of the clinical trial. Then third aspect is the evaluating one or more intervention aimed at identifying or diagnosing a particular disease or condition, examining the methods for identifying condition or the risk factor. So there are lot of aims are there. Some of the main aims are: one is the effectiveness of this new medicine, or effectiveness of the new device has to be investigated. Then what are the risk factors associated with that new medicine or new device? Then explore. Then what we can do to improve the comfort and quality of the life of the patient through supportive care. So these are some of the various aspects which are coming under the this clinical trial. And here you can see is that informed consent is a process used by a researcher to provide potential and enrolled participants. There is somebody is coming to you for and agreeing to participate in a medical trial. The person should be given information that is known by the informed consent. This information helps people to decide whether they want to participate or enroll or continue to participate in the study. To protect the participants and should be provide enough information to understand the risk, benefits and alternatives for the study. So whoever is volunteering to participate in the trial should be made aware of the risk, harmful effects and what are the benefits, and if there is any other different alternatives are available, that should be also informed to him. And this kind of a consent is known by the name informed consent. In general, the person must sign an informed consent before joining the study. Signing the document and providing the consent is not a contract. As I told you, just because he has agreed, given his consent to participate in the study for 6 months or 1 year or 2 years, any time that volunteer can withdraw from that. So that isn't, there is no binding contract. So that they can withdraw at any moment. So participant may withdraw from the study at any time, even if the study is not over. So these are some of the problems in medical research, especially in bringing out new medicine. Because if in India, many times many volunteers may come, but after 6 months of the trial, they say that I am withdrawing. Then what happens? All the money which has been spent on that particular person will be going waste. So then the research team has to study another person. That is why many of the new drugs are highly expensive, because they are undertaking repeated trials. Sometimes some of the trials may be failure. So this is the reason why new drugs are always very expensive. So clinical studies have standards outlining who can participate. And these standards are called eligibility criteria. What kind of individual, what kind of person can participate in a research trial? The factors allow someone to participate in a clinical trial are known as inclusion criteria. That is, normally one important inclusion criteria may be the health of the person or the age of the person. He or she may be belonging, maybe most of the time maybe 25 to 50. That will be the range of the age range usually selected by because he or she should represent an average individual in the society. So mostly the age group between 25 to 50 may be selected. So that is known as eligibility criteria or inclusion criteria. And some factors may disqualify someone from participating. For example, he or she has a previous addiction history. Some allergic reactions are there. He or she has a higher chance of developing cancer from the family history. They are investigating the family history studied. Many people in his family developed a particular type of cancer. So such kind of factors may eliminate a person from participating in a study. They are known as exclusion criteria. So there are certain eligibility criteria whether a particular person can participate in the study or not. They are known as eligibility criteria. Under the eligibility criteria, both inclusion criteria as well as exclusion criteria are there. So they are based mainly on the basis of age, gender, type and stage of the disease, and previous treatment history, and also the presence of other medical conditions. So these are some of the factors which are usually considered, and these healthy volunteers are also always paid a good monthly salary during the period of their study. So there are some individuals who are always ready for going for this kind of, because they will be get good honorarium for participating in the study. So what are the benefits and risks of joining a trial? Sometimes especially in this coronavirus, when many healthy people have participated in it, they didn't know that this vaccine may be effective or not, but still they were ready to participate. Volunteer in clinical study trial participate in the development of medical therapy that offer better treatment and even cures for life-threatening and chronic disease. There are risks also involved. One advantage is that they will be getting in a new treatment very fast without any expense. That is one advantage they are having. In some studies, participants receive a physical examination and their medical history are reviewed by a team of physicians. So that will be before they are being enrolled in the study. Then their health will be continuously monitored. So that is, the research team has a responsibility to make sure that the human volunteer who is participating in their study remain healthy and in a good condition. And that is a legal obligation, legal responsibility, and for the research team also, his health is very important, because only if he remains in a healthy situation, they can properly evaluate the success of their new medicine. So detailed description of what is expected of volunteer will be outlined in the consent form. That is, earlier we have been mentioning about what is informed consent. In the informed consent, all these aspects will be clearly mentioned, and what is expected from the study is also given. So what are the benefits for the volunteer? They will be able to play an active role. Is because of the participation of several human volunteers, we were able to bring out new medicine, new vaccines, etc. Gain access to research treatment before they are widely available, and most of the time that will be freely available for them. Obtain medical care at health care facilities during the trial, then help others by contributing to the medical research. So only if some of the people are volunteering, new drugs can always be bought out by the medical team. So these are the advantage for them, and they also have some risk are there. There may be unpleasant, serious, or sometimes life-threatening. Sometimes nobody is sure, even the research team may not be able to clearly predict. They may have undertaken trial in the rat, rabbit, monkey, etc. But still, sometimes when the same drug is introduced in a human being, they cannot come 100% sure that this is going to produce this particular reaction. They cannot be 100% sure of that. So sometimes the death can also happen. So there is life-threatening side effects are there. The experiment treatment may not be effective. Sometimes they may be advertising that it is highly effective treatment. Actually, it may be a useless or sometimes harmful treatment. The protocol may require more time and attention than a non-protocol treatment. That is, including trips to the study site, more treatment, hospital. So that is another headache for them. When you are participating in a study, sometimes because of this complication, after the maybe study period maybe for 6 months or 1 year. But because of the side effects, you may have to visit the hospital maybe for another 2 years or 3 years. So it may be headache for them. It may be a unpleasant experience for them. So these are some of the risks for the volunteer. Access to personal information is usually, that is your personal details, your personal history, your medical history, or your family, all these will be available to the medical team also. So these are some of the important side effects of the important risk for the volunteer, but there are benefits are for. So every risk has some benefits, sometimes harmful risks are also there. So regarding the informed consent, these are the important things that we have to keep in your mind. So this is regarding the working with human